Hi, everybody. I am the editor-in-chief of The Persistent. We are a new media company run by women and writing about women. Look it up and subscribe. We're here, however, to talk about health. Our healthcare systems are so broken. Our health is so broken. The way we talk about health is so broken. How we integrate health into our working lives is broken. We dismiss women's pain. We overlook serious mental health issues. People feel unsupported and forgotten by the system. And yet, when we ask people how they really are, the answer is almost always, fine, great. Panelists, how are you today?
Great.
Everyone's great. We're all great. How are you, audience? Everyone great? Great. Why is it so hard for us as women and men to talk about what we're experiencing? Why is it so hard to go there and ask the questions? Does health feel yucky, shameful, embarrassing? Yes, to all of it. But if we don't talk about it, we don't normalize it. And when we fail to normalize it, we fail to take care of it. And that's what we're here for today, to start taking care of it. And on our panel, we have experts and problem solvers and storytellers and researchers. We have people raising awareness in all sorts of ways. So let the problem solving begin. I am so very, very, very delighted to introduce you to our panelists. They are fantastic. Right next to me, I have Teresa Barreira. She is Chief Marketing Communications Officer at Publicis Sapient. I hope I said the names correctly. I'm doing my best. Then we have Lucy Kallin next to her. She's an Executive Director with Catalyst. And then over on the end, we have Ines Leonarduzzi, and she is an entrepreneur. She's founder of Digital for the Planet. She's also an author. And then, well, somewhere, hopefully joining us, we have Aiysha Malik. She's a mental health specialist, and she is with the World Health Organization, and she couldn't be here today in person. I hope eventually we see her. And there she is. Hi, good morning. We're so happy to have you here. Thank you for joining us, and thank you for being here for this really important conversation. Teresa, I actually want to begin with you. You are American, Canadian, Portuguese. You have this really multifaceted vantage point on what healthcare can be. So I want to ask you, what does good healthcare look like in your viewpoint? And please feel free to talk a little bit about what it's looked like in your past and in your childhood.
Yeah, being exposed to different healthcare systems, very extremes, for no testing to over-testing, I come to realize that good healthcare is not just about access, infrastructure, or innovation. It's about humanity. It's about looking at a person in a holistic way and making a connection with that person. I think the problem today with modern medicine that we tend to focus on curing versus healing. And often we tend to address the symptom versus the cause. And I believe medicine's become so specialized and subspecialized, then we tend to forget of the whole person and to look at the person as a set of symptoms and parts. And so I think, as you said, I've experienced healthcare in different countries, different systems. Unfortunately, I actually don't believe there is a perfect system. In the country that I live, the United States, the healthcare system tends to favor innovation and speed, but does lack agility. Then in Canada, where I also live half of the time, it does offer equality and fairness, but it does lack agility. And then in Portugal, where I grew up in a very small town, we just didn't have access at all. But when we did it, was personal and personalized. So I think overall good healthcare is all about those things, but ultimately I think it to be holistic.
Thank you. That's really interesting, and it's sort of staggering that certainly in the US, where I'm from, there are so many healthcare deserts where people really can't get access to a physician at all. And yes, you're totally right. The innovation, the technology can be really advanced, but if you can't access it or you can't be seen, the human in the system, it's just terrible. This may feel like a leap, but I'm going to go straight into one of my favorite topics, and I'm sure a favorite topic in the room. We're going to talk about perimenopause and menopause, because Lucy, you have been focusing a lot on that, and it's one of those issues that is major part of healthcare, massively overlooked. So at Catalyst, you do a great deal of research, and one particular area has been perimenopause. You were telling me about a recent study that you did looking at workplaces across various countries. I wonder if you could tell us a little bit about that study. I know that not all the findings are complete yet, but what we sort of know so far, and talk a little bit about what taking the lead on menopausal care and support might look like.
Thank you very much. Actually, I was here yesterday and I was listening to Emma Card talking about some of the data points that, I need to remember to move my mic, some of the data points that they found in their own research. And I think the one thing that is...
Was that the Deloitte study?
The Deloitte study that was being shared yesterday. The 1 in 5 women are going through, this is our data point, that 1 in 5 women are going through menopause as we speak. So I look at this room, and I think, how many of that? However, from that research, we found that 84% of the women that we surveyed were saying that more needs to be done in the workplaces to make it a place that's actually suitable for women to work when they're going through this experience. That it's actually very difficult. And I was also thinking about it because I'm going through it now. And one of the things that, as I was coming through today, I was saying, how hot is the room? What do I need? Do I need tissue and all of this? How shiny is my face? But also, how easy is it to talk about it within the workplace? And out of those women that we surveyed, when they were saying that 84% were saying that more needs to happen in the workplace to make it normal, to normalize the conversation, what they're saying is, what we need is to be able to have the conversations easily. So psychological safety is super important. We need to normalize it so that I can go to my manager and talk about it. We need to understand that perhaps my colleague or whoever, my boss or whoever it is, may be going through it. So we need to move away from opening the window to let fresh air in and actually have policies that reflect the fact that we know that this is a real problem that's affecting a lot of women. 1 in 5 is a huge number. And then out of those, 3 to 4 say that they will not discuss it, they will not disclose it, they will not talk about it to anyone because they don't feel that they can. And I think that's really sad.
All right, that's really interesting. You know, one of the things I'm thinking about, and certainly in the US, like we have gotten to this place where we really like to talk about menopause, which is great, right? A big round of applause for that. But I think what's interesting is sort of like, okay, maybe the talk comes first, the actions are sort of a bit slower to follow, open a window, fine, put a glass of water, that's nice. But the other thing is there's sort of a counter sort of argument to this, that talking about it is great, but it also raises some surprising risks in a way, that it sort of perhaps centers the woman's body, it makes age this factor that maybe was kind of no big deal and suddenly it is a big deal and it's being discussed. Can you talk to some of those sort of counterintuitive arguments about talking about it? And I'm not saying we should put the genie back in the bottle, to be clear. Like, we should be talking about it.
Yeah, we should.
But it comes with risks, and that surprised me.
Correct. So I think that one of the things that, so our survey, by the way, was very global, and we looked at Japan, we looked at UK, we looked at Germany, we looked at France, Sweden, and then we looked at North America. So there's a few things. One, the women will say, I will not talk about it because all of a sudden I'm put into a box in terms of age. So I'd like to think that most of you thought, oh gosh, she's in her 20s, how did she get there that quickly? I doubt it, but you know. But there is a thing where people say, I don't want to talk about it because all of a sudden people are judging me what my age might be. And then they're making decisions about my career path based on that. So there's that risk to the individual in terms of, do I really want to talk about it because do I want to then face the judgment I may have from others? But the other flip of that is that the risk to the organizations that don't do anything about it is you're losing a talent that's incredibly experienced, because by the time you get to that level, you're probably quite senior, or you've gained a lot of experience in terms of across the sector and all of that. So you have this risk of losing a talent that will cost you a lot more to try and replace. And in a world where
business case.
Right, business case for it. So I do need to remember to move the mic. But there is something around the cost of replacing that's so much higher in comparison to actually changing your policies, your working environment that people work in, creating an environment where people can take time off to say, I need to go and see. But also the other thing is educating not just the employers per se, but also the medical practitioners that we come across. The shocking numbers of how many people don't know. I'm still going through tests. I think I now just do it for fun with some of the doctors, because there's like a whole bunch of things that they don't know. So they're like, I'll say, I'm experiencing this, and they're like, oh, I wonder what that is. Is it your liver? Is it the... I'm thinking, no, it's menopause. But it's the fact that the lack of knowledge is really high. And so there is a responsibility of teaching people what it means, but educating the practitioners in terms of what do you need to do to help organizations, but individuals, to continue to perform at their best.
And just add to that, I mean, I've experienced the same thing. And I live in America. People don't talk about it. They might say they love to talk about it, but they don't talk about it. And I think medical professionals don't talk about it. I brought it up with my family doctor 4 years ago, and her response is, there's nothing you can do. That's just not a good response. I brought it up actually with my team, and their response is, what's our position on it? Well, there's no position on it. Half of the population will go through this at one point in time. So I do think it's a society issue that, and my personal view, it's a lot related is to age. Because when we talk about it, we have to reveal our age.
Yeah, I think it's so interesting. I do feel in the US that all the celebrities are talking about it. Maybe I should have been clear. The celebrities are talking about it, and we're reading about it on Instagram, or maybe that's just my algorithm. But I think in the workplace, it's still like the sort of line that people are so uncomfortable with. So on that note, Aiysha, I would love to bring you in. You know, you focus on a lot of things. It's sort of almost hard to know where to begin with you, but I was going to go with workplace, but actually I'm going to dial back a little bit first. I want to just talk about the integration of mental health and physical health challenges and conditions. You talk a lot about these sort of two things going together. I think that's essential, and I wonder if you can explain what that means for our audience and possibly give an example or two. Why is it really important to knit these two things together?
Yeah, thank you so much, Francesca. And it ties in nicely to the conversation that we've just been having, because ultimately we are a whole body. And so when one part of it is affected, if your physical health is affected, your mental health will get affected in turn, and vice versa. So for example, if you are someone that has going through menopause, or you live with diabetes, or you live with what we call an infectious disease like HIV or tuberculosis, you are nearly 2 to 3 times more likely to experience a mental health condition, usually anxiety or depression, let's say as a result. And it can be bi-directional. If you have a mental health condition, you may be more likely to also then have problems with your physical health. And it's really interesting for me to hear about the colleagues before talking about their experiences with the health system, where we're not looking at people as a whole, and we're just looking at one thing at a time. And usually in the medical community, it's looking at the physical health side of things. So when women are going, if I take the example of women, when women are going to their primary care practitioner and wanting to talk about issues related to gynecology, whether that's menstruation, PMS, menopause, whatever stage you might be at, your practitioner is having a hard enough time focusing on that area of health, which is quite neglected in medical training, and on top of that may not be giving consideration to the mental health aspect of things. We know that if you give effective mental health care to people living with a particular physical health condition, at the same time that they're receiving that care for that physical health condition, the outcomes actually improve their physical health outcomes as well as their mental health outcomes. So there's really wonderful examples of this where people can receive care for their depression alongside having cancer, alongside having diabetes, and the outcomes are literally physical. People's cardiometabolic indices are literally changing as a result of having the combination of those interventions at the same time, not just focusing only on symptoms and just one part of health.
That's really really interesting. And I want to sort of bring it into the workplace as well. We talked about practitioners and physicians and what they should be doing and sort of looking at things holistically. But, you know, when you and I chatted before, you also mentioned that managers and leaders in the workplace should have and play a really strong role in protecting staff mental health. And I think that's often something we possibly don't think about. So should helping to protect mental health be, and possibly physical health, I guess, as well, since they go together, should that be the purview of the workplace? Can you talk a little bit to that? To that?
Yeah, definitely. It's certainly our position that addressing mental health is not only the role of the health system, it absolutely involves other parts of society. And when it comes to children, it's quite easy to think about because it's very easy to say, well, young people spend a lot of their time in school or education for the most part, in most parts of the world. So there should be things there around their mental health. Well, the parallel for adults is the workplace. It's a ready-made environment where many of us spend most of our waking hours, and it's an environment that has the potential to stop people from having worse mental health or providing access to that kind of support. But what does that actually mean? Because I suppose you were talking about the importance earlier, you were talking about the importance of talking about certain health conditions in the workplace. And there's a lot of buzz around we need to do better to talk about mental health at work. And it's great when we see leaders take a step forward and say, hey, I've had a mental health condition. This is how I managed it. This was my experience. And that has a huge impact on stigma in the workplace. And that's great. But saying something is important and talking about it is not the same as showing it's important by putting resources into it. So we need to make sure that your HR budgets, your occupational health budgets, your diversity and inclusion budgets, that there's lines in there to actually cover your staff having access to things that are effective for their mental health or their physical health, not just only talking about it. I think we're ready as a society to go beyond that. And that's really important because so many leaders in many sectors, not necessarily, I'm aware of the audience I'm talking to, but in many sectors, we might be there in a leadership role because of our years of experience or skills in, you're the loudest in the room, you're the most ambitious, you're good at suppressing your emotions when you have to make decisions. And this is what we laud as leadership skills in society. But this menu of options is not what leadership skills fully are. Things like being able to be collaborative when you make a decision, being able to regulate your emotions when you're under huge pressure, which managers are. These kinds of skills have been given the disempowered term of soft skills. And they're not soft at all because so many people don't have these skills. And that's what we need to make sure managers and leaders are being equipped with, because that will put people in a better position to protect their staff mental health than their own mental health as well.
Right, and the business as well. So
Indeed.
We need to start valuing soft. Ines, I'm so excited to get to you because you're a storyteller, and I think you're not going to talk about menopause. So let's... You're also a tech entrepreneur. You've just had 2 children, which by my count means you have 3 children, 1 business, 2 kids. And I wonder if you can talk a little bit about your personal story, your experience, what it's been like having a second child, the community, the support system, all of it.
Thank you very much for inviting me. Thank you everyone for being here. I come at the Women's Forum for 10 years, talking as a tech entrepreneur, and today I really wanted to come as a woman, only a woman. So I gave birth 1 month ago to my second child, a little girl, and I discovered a new experience of motherhood. With my first one, I failed breastfeeding. I really wanted to breastfeed for many reasons. First, intimate, personal, but also because social pressure. You're a very, very good mother when you breastfeed. You don't have the infrastructure at all to do that, but it's very nice. And when I said that, once I've said that, I totally, profoundly, completely understand and empathize with mothers who don't want to breastfeed, because this is so hard. And this is my point. For my second child, my little girl, I managed to breastfeed her because I learned. I did researches, studies. I went and looked into studies. I spoke with doctors, specialists of breastfeeding, etc. And I discovered a whole world. I discovered that we are magical. Us women are amazing creators. And my first point is why we should be taught how amazing, how complex, how cyclic is the body of a woman. And when I say we, this is men and women. We should teach that, be taught that from school, because we are thrown away into the motherhood wild system without any knowledge about ourselves, our body. We actually lack of sovereignty about our bodies. Breastfeeding is also why I completely understand a mother who doesn't want to breastfeed. It's because there is no system or infrastructure for it. And I will take an example. I'm always outside with my child, and I breastfeed a little bit everywhere where I have to. And last time I was on a restaurant, and my baby was hungry, so I started breastfeed. And the very lovely waitress came to me, very lovely, and she said, "We have toilets if you want." And I answered, "Oh, thank you, I've already pooped." And you know what?
Thank you for saying it.
We really have to answer like, and she was like, "Oh, it's for you." And this is the point. This is for me. She is nice, and she doesn't want to hurt me when she proposed me the bathroom to give food to my baby. She really wants to help because she thinks I'm embarrassed. But this is the society who is embarrassed, not me. I'm super fine with showing my boobs because this is not first sexual. This is first a tool for making babies grow.
The implication in a way is that you should be ashamed, and therefore you should want to go to the toilet where you're hidden because you don't want to show this really normal thing.
Actually, I think society idealizes the symbol of motherhood, but hates the role of motherhood. We have to hide.
Totally.
You're a good mother, that's nice, but don't show me your breast. You're too Robert.
We like it in concept, but in reality it's a bit much.
And the proof is we don't have infrastructure in the reality, but in the literature we have many things for us to remind us we have to feel guilty because we are never good enough. So yes, I could talk about motherhood for hours, but my first lesson in the second pregnancy was the fascinating world and fair world of breastfeeding.
I want to keep on this idea of sort of storytelling and explaining sort of these feelings. I want to explore a little bit of that, but I want to do it with you, Teresa, because you have made a film. You produced a series of documentaries, and the most recent one was about access to healthcare. And I'm hoping we can show a very short clip from the documentary, if anyone can hear me.
What's the truth? I know that this small town needs doctors. And without doctors coming to these rural and underserved areas, people are gonna die. Dr. Hotz helped develop this community health center for the underserved. The system that brought me to this area.
I realized that the healthcare system has problems. This is a big problem. Can we develop a program that takes care of everybody? Good idea. What was this country based on? The right to life, liberty, and the pursuit of happiness. There's no pursuit of happiness if you're sick.
I don't want someone to have to live in New York City to be healthy. They should be able to live in Albany, Georgia, and be healthy.
This is the most unusual filming process I have ever done. It's like going to confession, man. I mean.
So this documentary, which is now out, we can watch it. It's covering a town that I'd certainly never heard of called Albany, Georgia, in the US. Probably most of us will never go there. So I'm curious to hear from you in your words, why this place? Why does this story matter in particular as it regards access to healthcare?
And thank you for showing that. By the way, this is a clip to the film. The film premiered at the Tribeca Film Festival in June. If anybody is interested in watching it, it's on YouTube today. But why this film? This film is a series of 3 documentaries that I produced in different issues. This was on healthcare access. The first one was on homelessness. The second was on mental health and actually in criminal justice reform. And the reason I did these documentaries was for 3 reasons. One, I wanted to show that technology can and should be a force for good. Technology is not the enemy, it's the enabler. And when we, as companies, create solutions that are centered on people, I believe we can create a society and a world that is good for all versus just a few. The second thing I read this film is because I wanted to show that actually the impact, the work we do at Sapient actually matters. And I wanted these films are not branded, they don't even mention the solution, they do not mention our name, but I wanted to show that we actually live our purpose through our work. This is not philanthropy, this is not CSR. And then the last reason, probably the most important reason, this film in particular is very personal to me. I grew up in a health desert, in a small village in the north of Portugal, where we did not have access to healthcare. We didn't have a hospital, we didn't have a permanent physician, a doctor would come to the town once a week. And during that time, everybody would gather to see the doctor, and some people even brought their goat. It was a community affair. So I wanted to show in this film that healthcare should not be based on your address or your zip code in this case. And so for me, this was personal to tell the story. So what these films do is give a platform to give a voice and to enable those voices to show the people that do an incredible, extraordinary work, like Dr. Hotz and Dr. Favors in Albany, Georgia. In the United States today, over 100 million people lack access to a primary care physician. So I wanted to tell this story by focusing on their journey, why they're doing what they do, and also to inspire people, medical students, to go to these health deserts. So this was really important for me, this specific story, to really give a voice to a really important issue.
Thank you for telling that. I can't believe it, but we've almost run through our time. So I had a lot of other questions that I was hoping to ask, but I think I'm going to summarize our conversation, which was quite far-ranging, with this idea of normalizing pregnancy, normalizing our feelings as a mother, as a parent, normalizing menopause, normalizing mental health, normalizing the idea that everyone should have access to excellent healthcare. It shouldn't be out of reach. It's unacceptable. And I'd like to ask each of you a little challenge based on your expertise and what you're sort of thinking about and experiencing. What's going to be your healthcare normal? Is it talking about it? Is it bringing up an issue over coffee with a friend? Is it raising your hand in a meeting at work and talking about it there? I know you're not prepared for this question, but I think we have to think on our feet. So, Ines, why don't we begin with you? What's going to be your healthcare normal to start putting this ordinariness of what we're talking about in front and center?
During one night, I was wondering how much cost symbolically the price of a motherhood for 1 year, and I took a fair rate, $50 per hour, and just in terms of pregnancy, birth, and childcare for the very first year, it's a little bit more than $900,000. So all mothers should be millionaires today. And we can laugh at it, but I think it's very strong, very, very, very deep to realize that we produce the demography. We have in France a president saying we need demographic mobilization, le réarmement démographique, but it has a cost. And I'm not talking about the price of love of our kid. And just one last thing, maybe we should normalize about mental health of mothers. It's super okay, and I know I will maybe shock people, but it's the point because it provokes reflection after this panel. But there is a big difference between love for our children and fulfillment as a woman. There is a frontier when we are a mother that we can't go after, and this is the land of women. And it's super fine, and I will finish like this, it's super fine to understand that you can love having your children, you can love having them, but you can also at the same time regret being a mother because nobody prepares you for that. So it's super fine. I know many women regretting loving their kids, but saying, I regret because I sacrificed so much. We should normalize all of that.
Normalize the feelings, normalize the economics, which are really staggering. All right, Aiysha, you have a tweet-length response. I know, it's not good, but this is what we have. So how can you normalize this conversation? What can you do in your own life?
I think I will keep fighting for people to have access to quality, affordable mental health care, not just curative care, but I mean the whole spectrum. I want you to go to your primary care doctor and they actually went to a university which trained them enough to be able to have a decent conversation with you. I want you to be able to find an affordable psychologist so you have access to psychological interventions when you need them because your country recognizes the psychology workforce. And I want your government to match its spending for physical health to mental health, meaning I want them to bump up their only 2 to 5% investment in mental health to match the rest of it that they're investing in physical health. And that's what I will keep going for on my end.
All right, Teresa, what's going to be your healthcare normal or plan of action? Short.
I think for me, I really think we need to normalize menopause. I think it's an issue that we don't talk about it. And I think we have to talk about it with everybody, regardless of age. It's something that half of the population will go through, and it's astonishing. How do we only think about it when we get there? We should talk about it very openly. That's what I hope for.
Last word, Lucy. What's your healthcare normal?
I'll continue to asking the question why. I work for a research organization, so it's the why. Because sometimes that can be exhausting, especially when you're dealing with medical people, whatever, you can get to a point where you're thinking, oh, but I'll continue to own that, because I think until we answer the question, the why, and we can then put in place the what needs to happen. So I'll be part of that conversation.
Spoken like a researcher. Thank you so much. Thank you for being here. I hope you loved this panel. They were amazing. Big round of applause. Thank you all to all of you, and to Aiysha for